Hi, I'm Jay, and I was a service user of mental health and addiction services for 16 years. Looking back on that experience, there was perhaps a lot I would have changed about it, but I couldn't. So I really wanted to put my energies into other people who were perhaps still in that experience of mental health and addiction. I became a volunteer at a local addiction service in Sheffield, and part of my role, or a big part of my role, was to engage with service users. So I was kind of pointed in the direction of the waiting room and told to sort of go and do something with them. And a lot of consultation stuff with service users, surveys, questionnaires, those sorts of things. But they were always difficult to get people to engage with, and if they did it half-heartedly. And it really felt as if it was something we were doing at them, rather than with them, rather than really engaging with them. Our clinical director, Dr. Roger Smith, came across patient opinion, and because it involved service user engagement, it fell into my lap. And so I was a bit sceptical. It was the internet, and I thought our service users would be interested. But what really convinced our service users of the importance of this and wanting them to engage with it was the fact that it was completely confidential, it was anonymous, and it was third party. The biggest fear for our service users is to say anything about the service that may ultimately affect their treatment. So that was a real worry for them. And the patient opinion immediately, because of its nature, made that a non-issue. Our first clump of postings was all about waiting times. There was a lot of frustration and anxiety generated in the waiting room around people not knowing how long they were having to wait for, why they were having to wait, if they'd been missed or forgotten about, the waiting to see a doctor or a nurse or a therapist. It's already a quite anxious time for them, and this was just made worse by a lack of communication on our part. As soon as we realised that this was actually having an impact on our service users, and to some extent reinforcing their expectations of how they get treated in society, we immediately began to communicate a lot better with our service users. So if the clinic was running half hour late, they were told, just relax, go out, have a cup of tea or whatever, come back, and then you still won't miss out. So all that frustration and anxiety wasn't built up in that moment, so that when they did get to see the doctor, when they did get to see the therapist, they weren't angry, agitated a bit by the experience they'd already had. It sounds really quite simple, but we didn't realise the impact that was having on our service users. So so now we communicate much better. We're going to get digital signs up that will tell people at a glance exactly where they stand, and that they're not missed, nobody's forgotten about them, they're not being ignored or treated badly. It's a really, really important issue for our service users. Once they saw that in action, that process in action, because all our posting and some responses got on the wall in the waiting room, so other people were able to see that service users had some ownership over what was happening, and the service users were able to play a part in forming their service and what it did. It encouraged other people to get engaged with patient opinion, and for other people to post much more sophisticatedly. So people really trusted it now. So we had an issue of uptake of hepatitis vaccination screening. Through the feedback from patient opinion, we were able to identify that the real barrier to that for our service users wasn't engaging with it or having it done. It was that it was always made an appointment somewhere in the future. It was a long time away from them, for them, that when the day only came, they failed to make the appointment. So having one-stop services that allowed service users who were already engaging with the service to get the screening and vaccination done at the same time immediately increased the uptake of that. So it was a real great improvement in the service for our service users. Continuing on from that, because people felt really confident about using patient opinion and confident that they would get a response and that would be completely anonymous, we had postings from people who had one particular couple who were substance misusing and had a newborn. They'd had a bit of a slip-up and were really frightened that because they'd used once after a period of abstinence, that they might get the child taken off them. So they were able to ask this sort of question and make this inquiry via a patient opinion and be reassured by the response. And that kept those people in engagement, that kept those people in treatment. It was a hugely important thing that happened, and without patient opinion, I'm not sure that would have been as happy an outcome. In terms of the staff and their response to it, they were slightly sceptical at first, I must admit, but it was really fantastic to see that over 50% of our posters were really positive. Some were mixed and some were critical, but each of those was a learning opportunity, and it was fantastic for staff to be reinforced in the good work they do by feedback from their service users. So once that began to happen, everybody got really keen and got really involved, and now it's part of our structure, and it's an ongoing process at Guernsey House where we constantly take real-time feedback from our service users, and it just gives us a real edge in terms of what's going on, how our service is working. Some of the problem with surveys and questionnaires would be that by the time we got through them and crunched the numbers, it was too late to react to it, or the response to it wouldn't be quick enough. So patient opinions has given us a real finger on the pulse of our service users and allowed us to make a great deal of service improvements, but most importantly, it's allowed our service users to feel engaged in their treatment, to share in it, take part in it, and drive that treatment forward.